Mr. President, last night the Republicans in the House revealed their plan to scrap ACA and replace it with something much worse, TrumpCare. There are so many things that are wrong with this bill, and a lot of us are still going through the 184 pages and all of its implications, so it's impossible to encapsulate all the difficulties of this legislation in one speech. I'm going to highlight 8 problems with this bill to start. First of all, this bill is a complicated and rushed mess. Despite the fact that they had 7 years to work on their own plan, the Republicans cobbled together a bill that just makes no sense. In an effort to make everyone in their caucus happy, they have made no one in their caucus happy. And that's why we've seen conservative groups from AEI to AFP, the Heritage Foundation, the Koch brothers come out and express opposition to the legislation. Second, this bill cuts Medicaid. And they're going to use a phrase called block grants, but I want everyone to understand that that is cutting Medicaid. That is a euphemism for cutting the resources for Medicaid. This cuts a program that helps more than 70 million Americans across the country to get the health care that they need. It means less care for pregnant moms, less care for families with loved ones in nursing homes. Nursing home benefits will be totally trashed. And all of these changes will reduce Medicaid to a level not seen before. And by the way, Medicare doesn't escape the axe. It's also in trouble if we enact the House legislation. TrumpCare will actually move up the date of insolvency of the Medicare Trust Fund by 3 years to the year 2025. To the year 2025. That's not 20, 30 years from now when they talk about the Social Security Trust Fund. That's quite soon to have Medicare be insolvent, and they're increasing, accelerating the date at which Medicare becomes insolvent. Third, this bill hits the elderly with an age tax. So here's how the law currently works. It's basically a cap on the amount that you can charge, an insurance company can charge a senior for health care. It says that you cannot charge more than 3 times the amount that you charge a person for a senior citizen. So it's capped at 3 times what you charge for young people. This would increase the cap to 5 times the cost. So if a young person's health insurance costs $250, the maximum under the current law is $750, and now you're talking 5 times $250, $1,250 per month. This is an age tax, and if there's any doubt about how difficult this is going to be for senior citizens, ask the AARP. They are a bipartisan, well-respected organization that works in every state, and people, seniors across the country, need to understand what this age tax is. You will pay more for health insurance if the law passes as it is. Fourth, and this is a really important point, this is basically not a health care bill, because if it were a health care bill, everybody knows it would require 60 votes. It would be enacting new legislation. This is a budget bill, so all they can do really is cut taxes related to health care. And this is a bill that cuts taxes for rich people. And how does it finance it? First of all, it finances probably a lot of it by borrowing, and the other portion of it is by cuts to Medicare and Medicaid. TrumpCare has special tax cuts that only benefit the highest earning households, and another one that will go to insurance company executives who make more than $500,000 a year. You literally cannot make this stuff up. They're cutting taxes for insurance company executives who make more than $500,000 each year, and they are financing it by cutting health care for the people that we all represent. Fifth, this bill will blow up the debt and deficit. And the crazy thing is we don't actually know how much our debt and deficit will increase because Republicans are in such a hurry to rush this through without a formal CBO analysis. So we have no idea how much this is going to cost, probably trillions, but they haven't even asked for a CBO score. They don't want to know how much this is going to blow up the debt and the deficit because all of the fiscal hawks will be found to be hypocrites who have been railing about the deficits for all of their career, and yet this might be the biggest budget-busting piece of legislation in many, many years, and they don't want to know how much it costs. because they've made a promise, and they're going to go ahead and fulfill that promise no matter how ridiculous it is. Sixth, this bill will trash mental health coverage. The ACA was a huge step forward for the mental health community because it required insurance companies to cover mental health and substance abuse disorders. We are in a moment when every state is struggling with an addiction crisis. What I don't know is why we would rip away these services when so many people are counting on it to break their addictions. Number 7, this bill will defund Planned Parenthood because they can't help themselves in the United States House of Representatives. Planned Parenthood is a provider that offers health care to millions of women across the country. But this bill will stop low-income women from getting critical health services like breast cancer screenings from local clinics. And oftentimes, this would happen in communities where women have nowhere else to turn. Many community health centers don't have the services that women need, or they have twice the wait times that a Planned Parenthood would have. For women waiting to find out if they have cancer, that's simply not an option. And finally, this bill is just too partisan. I think we can all agree that our approach to health care could use some improvements, and I am more than ready to work with my Republican colleagues to make health care better. That's not just a rhetorical flourish. I have tried to back that up with my legislative actions. I've worked with Senator Hatch on legislation to increase access to high-quality care in hard-to-reach regions. I've worked with Senators Cassidy and many others on a bill to create a public health emergency fund. I've worked with Senators Wicker, Cochran, and Thune on a telehealth bill. And so we can work together on health care, but it requires 3 things: good faith, and there is no good faith in this piece of legislation. Number 2, bipartisanship. This bill, I'm quite sure, will get 0 Democratic votes in the House or the Senate. And the third thing is we need legislative hearings. We need to have a conversation in the light of day and let the American people weigh in, and we need to figure out what it is that they are doing to the American healthcare system. If they're so proud of their plan, why no hearings? If they're so proud of their plan, why not get at least a score from the Congressional Budget Office? If they're so proud of their plan, why do they lack the confidence that any Democrat will support it? Look, we do have the opportunity to work together to improve health care, but this bill is basically a mess. It's worse than I thought. I think it's worse than a lot of people thought, especially given that they've been talking about this for 7 years. So one might think that they would have had a really well thought through plan. This has all of the characteristics that something that was rushed out the door in about a 48-hour period. And so I hope my colleagues will join me in opposing this very bad piece of legislation and give us some space and time to do this right and to do this in a bipartisan fashion.